And tonight we want to talk about, we started fibroid discussion yesterday, right? We started that gist yesterday. So tonight we want to look at, even if there is fibroid, at what point would this fibroid don't even matter? Would it not matter? So when fibroids don't matter is tonight's gist. And it's a continuation of what we discussed yesterday, so that we'll build on that. I will still continue tomorrow. Tomorrow is Friday, I think. Yeah. So much to talk about, because this fibroid, a lot of people are concerned. This thing, at least we were able to explain yesterday where it came from, what caused it, right? So let's build on that. Let's build on that knowledge. Doctor, can we chat? Yeah, of course we can. We can. We can. Just drop me a message in the DM, right? So that I don't forget. Right? Thank you. We can. Right? All right, guys. So who is ready for the gist tonight? Please, talk to me in the comment section if you're ready. Just type ready. Type ready or clock it. Right? Every heartbeat tells a story. This is fertility. When it comes to fertility, you don't want to take chances. And I tell you, infertility is something you don't want to wish your worst enemy. You don't understand. You don't understand. But I speak to you from experience. And a lot of people are suffering for nothing. And when I tell you don't pack your bags yet, when I tell you don't pack your bags yet, it means there is still hope. Is that okay? So let's work it out with knowledge. All right, let's talk about today. Today we want to look at when fibroids don't matter. Fibroid is there, yes, but when it doesn't matter. This is one of the truths that people may never hear anywhere, right? So the diagnosis that you have fibroid may not necessarily be a sentence to infertility, but you are just afraid for nothing, right? The ultrasound scan may say fibroids noted. Yeah, and immediately you go into that emotional roller coaster that you just spiral. That emotional spiral begins, right? And people will just start imagining, is this infertility? Is going to cause me miscarriage? Oh, so I'm going to do surgery. Oh, am I going to fail? My pregnancy is going to be failing. Some we even begin to grieve for pregnancy that has not even entered. So, my God, my pregnancy will not happen, right? You will not blame them, right? You will not blame them, because the word fibroid has developed a kind of reputation that sounds almost catastrophic when you hear it. Is there anybody, even you tell them there is fibroid 0 point something centimeter, they will still be afraid because it's so. Who is sending me the request? Thank you very much, Lady Chi. I appreciate you. Thank you. So I was saying that fibroid has developed a reputation that sounds almost catastrophic. Anybody diagnosed say, oh my God, my own don't finish. My own don't finish. Will I ever? Something like 2 cm. Oh, will I ever have a baby in this world? Simply because of the fibroid reputation that we've been bombarded with for many years now. All right, Lady Chi. Thank you very much. I appreciate you. Thank you. Right. But tonight, I'm going to expose to us the truth that many people are never told. Right? I trust that will bring you clarity. Please understand. that not all fibroid matter. And so what if you are diagnosed with fibroid? Right? Not all fibroids matter. So who is ready for the gist? Nobody is responding, so I'll just pass it over. I'll just pass it over to where people are ready to hear. So who is ready for tonight's gist? Oh, is it network? Is it network? If it's network, we'll wait for the network, because I need everybody to understand. I need everybody to learn. Right? I need everybody to learn and understand. Every journey begins with hope. Talk to me in the comment section if you're ready. Just type ready. And if you are just joining, make sure you're tapping on your screen. If you're not tapping on your screen, it means that you don't want this information. This is life. Every journey begins with hope. Every heartbeat tells a story. This is fertility. This is life.
Life they beat for belly, oh. One scan and everything change. This na heartbeat, really.
I show them the light where they shine for womb. Small heart they drum like African tune. Papa smile wide, mama eyes they tear. Now miracle they play for monitor, yeah. Some they find boys, some they pray for girl. But not healthy picking the sweetest world. Even when the news no sweet for air. We they stand strong, we they wipe their tear. This now heartbeat rhythm. Joy and pain they rhythm. Life they start for screen. Love they dance within. Every scan a story. Every tear a glory. This now my calling. This now my victory. Yeah. Heartbeat rhythm.
Heartbeat rhythm.
Some go dance.
All right, let's continue our gist. So I was saying that not all fibroids matter. All right, are we still here? Oh, nobody responded. So that means we're not ready for the gist. Or is it my network? Is it my network? I think it's the network. Okay, Christy LaBelle is here. Who is sending view once? Are you silly? You go do view once now, spoil all your reproductive system. Tomorrow you come and be looking for children. Anyway, they use my brain. All right, let's continue. Let's continue because sometimes not lost. Christy Labe, is it not true? You live a nonsense life in your as a young person. Then when it's time to start settling down, you'll be running from pillar to post. Spending money that is not necessary to spend. All right. So where was I? So I was saying that not all fibroids matter, right? Some fibroids may never affect fertility. Some fibroids may never affect implantation. Some fibroids may never even affect the pregnancy outcome, right? And some may never require treatment at all. Martha is here. Hello, Martha. Good evening. Good to see you. Our heart me has become a tomato, right? So that's interesting. Thank you very much. Good evening. So I was saying that some fibroids may not even require treatment at all, right? But that doesn't mean that fibroids should be ignored blindly. Especially if you were here yesterday, you understood where we're coming from, right? What it means is that the presence of a fibroid alone is not automatically the problem, right? That there is fibroid does not automatically mean that you have you're infertile. No. So tonight we'll do a proper examination, or we'll x-ray the topic. We're going to dissect what it means when there is fibroid and whether it truly matters, right? We'll also look when they are simply just innocent bystanders. They are there, but they may just be bystanders, right? Inside the uterus. Because when you understand the distinction, right, the way you approach that information will change. That they said it's fibroid would really not, you just want to know the details so that you know how to work with it. For example, somebody here just said they saw 2 centimeter fibroid, right? Remember yesterday we said when it comes to fibroid, it's about the size and the location. My crush is here. Good evening, my crush. Good to see you. You're welcome. So when it comes to fibroid, it's about the size and location, right? But remember, fibroids are extremely common. If there is somebody of reproductive age that does not know about fibroid, I wonder where that person has been, right? Why? Because fibroids are not rare abnormalities, right? They're one of the most common benign uterine conditions in women of reproductive age. Very common. Nowadays, even younger females now are having fibroids. Begin to ask, why? What is going on? Right? You know, many people walk around with fibroids for years without even knowing that it's there. Some of them will discover this fibroid only during their routine scans, right? So it comes as a shock. Whoa, I have fibroid, how come? Right? Some others will discover that during when they are pregnant, yeah? Or maybe when they are just doing some examination to investigate some other symptoms. Then it just, oh, there is fibroid. That is when they may even know that they got fibroid. Yeah? So that's to say, a fibroid diagnosis alone will just tell you very little about your overall fertility. So that one is just for your knowledge. But this is the biggest fertility mistake, right? Many people will focus only on, do I have fibroid? You're coming for an investigation with respect to your reproductive health, and the only thing you're concerned about is whether you have fibroid. Okay, if you don't have fibroid, does it automatically mean that you're fertile? Right? So a lot of people focus on that because, you know, fibroid now has a reputation, right? But I would rather have you Ask real fertility questions, like if there are fibroids, how are the fibroids behaving biologically? Right? Remember yesterday we talked about tribes of fibroid, right? So what tribe is your fibroid? Now we were saying that to say fibroids affect fertility through these aspects. Like fibroid affects fertility through its location, through the distortion that it causes in the endometrial cavity, through the size in relation to other surrounding structures, right? Including, it will affect fertility through blood flow, how it affects blood flow. Hello, Lolo is here. Hello, Lolo, good to see you. Good evening, you're welcome. You know, some fibroid can grow to the point of obstructing blood vessels, right? And also interfering with the endometrium. So these are the areas fibroid can affect your fertility. But if those mechanisms we discussed yesterday are absent, the fibroid may have little or no reproductive impact, even though it's there, right? So it's just there as a bystander, not doing anything, right? That sounds good, right? So you want to now go and find out what tribe is your fibroid. So a quick one. Let's quickly look at I'll try to itemize this one so that it will be easy to catch. If you are just joining, you're welcome. Welcome. We're talking about fibroids, right? Time to tell your story. Thank you very much. Good evening. Thank you for the heart, man. Right? So let's open that low impact situation carefully and see when fibroid usually don't matter. Yeah. So if you're just joining, you missed yesterday's gist. Okay, you may not try to catch up today because today is a build-up of yesterday. Is that okay? But just make sure you're sharing the live. Invite those who are battling with fibroids, right? Bring them. Let us help them. All right. So let's look at when fibroids usually don't matter. Yesterday we talked about when it matters, and we understand the tribes of fibroid. So today, when it's there, it doesn't matter. Let's look at it. Number one, the first thing we want to start with is small fibroids that are outside the uterine cavity, right? When you have fibroids going from the uterus outside the uterine cavity, we call that subserosal fibroid anyway. So usually they do not distort the implantation space. Because any fibroid that would distort the implantation space will affect your fertility. But if this one is not a threat to implantation space, it doesn't matter, right? Often they do not interfere with the endometrium entirely, right? The fibroids are there, but they're nowhere close to the endometrium. Yeah. Then if they are there and they do not prevent the transportation of sperm, those kind of fibroids don't matter, right? It still means that pregnancy may occur completely normally, as though there was no fibroid. Yeah. So the question again is, what tribe is your fibroid? If you missed yesterday's gist, don't worry, go to the YouTube channel, go and find out. Just search fibroid and start learning, because when I say tribe, you may not understand what I'm talking about. That's why you should not miss the live stream. Otherwise, you'll miss a lot, right? So I said all that to say that even when on ultrasound scan you get a diagnosis or a description of multiple fibroids, right? If the cavity remains unaffected, that is the uterine cavity, if it remains unaffected, fertility may remain essentially intact, right? Because their location and size is not affecting. So that is the first characteristics of fibroid that wouldn't matter to your fertility. Right, that's the first thing. The second one is fibroids that do not distort the endometrium. Right? If you are just joining, you're welcome. If you have not followed me, you want to follow me now. There are fibroids that do not distort the endometrium. What is endometrium? Endometrium is the inner lining of the uterus. That's the part that actually sheds, right? Every month, cyclical shedding, right? So this is one of the biggest idea in reproductive medicine, because embryo would implant inside the uterine cavity. Is that okay? So if fibroid stays away from that cavity or do not alter that lining as a whole, the implantation may proceed normally as though there is nothing. So that is why you can have two people with the same fibroid size. They may have completely different fertility experience or outcome. Somebody was saying yesterday that she knows somebody who had fibroid and had babies. We also know people who had fibroid and cannot be pregnant. Can you see? So again, I'm asking, what is your fibroid tribe, right? Go and find out. Find out from the video yesterday. So it's important to have that information. So that is the second thing. When the fibroid does not distort the endometrium, then it may not necessarily matter, right? The third one, when fibroid does not matter, when you have a stable fibroid with no symptom, yeah, because there are fibroids that remain small, right? 10 years ago, they told you there was fibroid. It was just like the size of a peanut. 10 years today, it's still the size of a peanut. That's what you mean by a stable fibroid with no symptom. Is that okay? It's small, it's stable, and just biologically quiet. It's just there. It's not troubling anybody, and hoping that nobody will trouble it, right? You don't have heavy bleeding, there's no severe pain, there's no pressure symptom, the tummy is not coming out, no discomfort, no implantation issues. But you know that there's one tiny little guy hanging around, right? So in these cases, all you just need to do is just to observe it. But again, through observation, you just discover that it's not troubling you, and it's hoping not to be troubled, right? So that is the fourth instance when fibroid really would not matter, right? Now the fourth one now is the fourth one is when the fibroids are found incidentally during a successful pregnancy, right? Now this often happens, right? A woman becomes pregnant naturally, yeah, and during her routine ultrasound scan, they just discover fibroid. You say, I didn't know that. Well, that's an incidental finding, right? Now this immediately will prove something important, right? That with respect to this person, ovulation occurred, fertilization occurred, implantation occurred, and the fibroid did not prevent conception. So in such instance, the fibroid really does not matter. Is that okay? All right. So if you're still here, talk to me in the comment section. Just type, I'm here. Then we'll continue. Because I want to talk about why some fibroids are so quiet, like me, right? Why some fibroids behave so quietly? Oh, is that nonchalant girl? You are here. Good to see you. So who's ready for that gist? Why some fibroids behave quietly? They're just there. Quiet, gentle, not troubling anything. Good evening, nonchalant, that nonchalant girl. Lewis Catherine is here. Hello, Aunt Chair. Good to see you. You're welcome. You're welcome. If you're trying to conceive and you're not following me yet, you want to follow me because I'm your shop plug, right? All right. So why some fibroids behave quietly?
Every journey begins with
See, from yesterday's discussion, we already know that not all fibroids are equally active. Right? Some fibroids have minimal blood supply demand. They are not asking for too much. Just give me small. Yeah, of course, lots of women, and that's why we need to give the information out there, because if they know, they will get a better approach to their conditions. A lot of people are suffering for nothing because of ignorance, right? So not all fibroids are equally active. Some have minimal blood demands. They just need just enough to remain there in your uterus so that they don't trouble you. Some others are there, but they grow slowly. They checked it 10 years ago, it was 2 centimeters or something. Then 10 years later, it is now maybe 3 centimeters. Then another 10 years to come, it is 3.5 centimeters. So quietly growing slowly. That is the behavior of this type, right? Then there are those that can cause little inflammatory disruption, right? There are those that can just small inflammation here and there, right? But from yesterday, we talked about those that can be very disruptive, and can cause local inflammation within the uterus. Right, so fibroids actually exist in a spectrum. Not that you hear fibroid does not mean that they're all the same. They're not all the same. And they will not affect your fertility the same way, right? There are those with multiple uterine fibroid. They've gone ahead to have babies. All the babies they want to have, right? It didn't stop them. But there are those with just one that is causing them a lot of trouble. Right? So you can see they behave differently. Right? Who understood anything up until this point? Do you understand anything? Talk to me in the comment section. Just type understand. Because the reason for this discussion, that's why I tell you, don't miss the live stream. Don't miss the live stream. Because you don't know when I'm going to be talking about you. Right? For example, there are people who have asked me about PCOS, and I took a whole week talking about PCOS, and most of them were not there. So just keep coming, right? 8 p.m. Nigerian time, Monday to Fridays. It will bless you. Is that okay? Vite Digital is here. Good evening, you're welcome. Only Gold is here. You're welcome. Is that only gold? The one I know? Only gold. If it's you, just say yes. I'm suspecting it's you. Chef Joy, you're welcome. Digital, you're welcome. So, oh yes, it's you. Yeah, I know, right? You're welcome. So you know the dangerous culture of over fearing fibroids. Every heartbeat tells a story. So I'm here to make you not to fear fibroids. Just know what is. Just know what's up, right? you know, in many communities, fibroids are spoken about with enormous fear. I went there. They said I have fibroid. Oh my God, my own don't finish, right? Your own already, you never finish, right? People will, because of that kind of diagnosis, what do you hear? Fibroid means surgery. Fibroid means infertility. Fibroid means pregnancy loss. All that is just creating panic. And when you panic, you make wrong decisions. And a lot of people are spending it for a very long time. Some of which their case is even worse. So you want to calm down. Let us help you with knowledge that will change your story. Is that okay? And that's why if you have not downloaded this book, your name is sorry. Go and download the preconception blueprint. It's in my bio. I have the link in my bio and download. Study it. Right? Study it. The only condition on that book is to study with your partner and knack waiting no good. Study and knack and study. Is that okay? Talk about ovarian cyst. I've talked about ovarian cyst. That nonchalant girl. So you want to go to my YouTube channel, go there. I keep on talking about my channel. Go there. You'll be amazed what you see there. So just look for Dr. Godwin EMB on YouTube. Look at all the stuff there. Right. All right. So where was I? So this notorious reputation that fibroid now have will create panic-driven decision making, which a lot of people have gone all the wrong directions and worsen their fertility condition. Right? But you need to understand that medicine is more precise than fear. You don't approach your health from place of fear. You'll be making this. That's why you drink all manner of things. Anybody that says this thing is working, you go and take. Because the question is not really whether fibroid exists. Right? The question is, are they functioning, or are they functionally interfering with your fertility? Are they affecting your pregnancy? That's what would matter. Every other thing you're saying is just your own fear. And that will change the whole conversation altogether, because now you have knowledge. Right? So if you have been diagnosed with fibroid, let us see the result. Let us interpret it for you and douse your fear. Is that okay? Somebody asked the question, can large fibroid still be there and sometimes don't matter? Can somebody have large fibroid and yet it still wouldn't matter? The answer is yes. And that will depend on the location. If you have been diagnosed with fibroid, I will always ask, what is the size and what is the location? Before you begin your panic-driven decision making, right? Because you can have a relatively large fibroid that is growing outside your uterus. Yes, you can. Right? Of course, it's going to cause you pressure. Yeah, because of course it's occupying space. So that's why it's going to be it's occupying space and it has weight. So it's going to be causing some pressure symptom. But largely because of its location, it may not be affecting implantation. Right? But meanwhile, a much smaller Submucosa fibroid may severely affect. This one is small, but where it is you don't ever carry belly. So, the location matters. Is that okay? The location matters. When it's sitting in the wrong place, it's going to affect you for a very long time. That is why location often matters more than the size alone. You can have very large fibroids sitting outside the uterus, yet you can conceive, carry your baby, deliver, and all good. But for some people, one tiny fibroid sitting in the wrong place, they've been going around for more than 5 years now, wondering why pregnancy is not happening. Because you need to understand the behavior of this thing called fibroid, right? So don't panic. That's what I'm trying to say. Don't panic, right? Don't panic. Some fibroids simply will just require you to observe it, right? Some you will need follow-up ultrasound to just check this progress. Yeah, I think I have a few people who they are not married, but they're just monitoring the fibroid that they said they had. So hoping that it does not cause them trouble. So that's a sensible thing to do. And some fibroids, you just want to observe them, monitor them to see at what point they begin to cause you symptoms. Because some of them are just there, they are not going to trouble you, right? And many of which will not need immediate intervention, right? Especially if your cycles are normal, it's not troubling your cycle, your pregnancy is occurring as at when due. Lady G is here. Pregnancy is occurring and your uterine cavity remains unaffected. So those ones, don't worry about it, right? But when fibroid becomes more concerning, that is where a lot of times it confuses people. Now, fibroids matters more when they distort your uterine cavity. So for some of you that usually get those pictures, when you want to share them, you share with the picture so that we see, oh, you have fibroid, what is it doing to your uterine cavity? So it's going to help. Is that okay? Some others will cause recurrent miscarriages because of where they are sitting, or they are too large and they are distorting the uterine cavity and causing severe bleeding. That can happen. So this is kind of things you see that becomes cause for an alarm, right? Because some can obstruct even the fallopian tube. I know what that means. The pathway for sperm to locate the egg and for embryo to come down to the uterus. That is blocked off because of their location. And there are some that triggers pain and even make you anemic, right? So that's when you need a more deeper management, and your doctor will attend to you and discuss some of these things with you. Is that okay? So fibroids are not automatically good or bad. So we just need to know what was seen, what was assessed, where they are, and what the size is, right? It's more of a structural variation that we want to see, right? But remember that some fibroids are just there quiet. They behave quietly, innocent. They are not troubling you. While some others, they are like, they disrupt the function of your uterus, basically, right? So when you understand these categories, this spectrum of behavior, your approach to management or solution becomes even clearer. So pregnancy success will depend on implantation space, right? Will depend on the endometrial receptivity. It will depend on the blood flow around that area. Also hormonal coordination and the overall area around your uterus. So if fibroid does not meaningfully disrupt all these things I just mentioned, Lady G, good evening. You are welcome. So if fibroid does not meaningfully disrupt all this system I just mentioned, it will not affect your fertility. So that is when the fibroid does not matter. Is that okay? That is when the fibroid does not matter. So when you speak of fibroid, it is individualistic. Do not say, oh, my sister had fibroid and she gave birth to twins. That is a very wrong way to look at it, because you have to speak of fibroid with respect to her alone, not comparing your case with her case. It will not be right to do so. Right? So don't rush into panic decision because they told you have a fibroid. Instead, you want to find out what is going on. Right? So what do you want to do? You calm down, ask questions. And if you are still confused, come back. I will direct you on what to do. Is that okay? That is the gist of fibroid. If you have any question or you have fibroid and you are still confused, send a request, come and ask me a question now. If there's no question, I'll go and sleep. Right? All right, if you have a question, please send a request, come up. And a question on fertility generally, not necessarily fibroid. Is that okay? Not necessarily fibroid. Every heartbeat tells us